So again, I'll say good morning, everybody, and welcome to the NORC program on medical marijuana. And we have the pleasure of having with us this morning Yvonne Duco, and I hope I'm pronouncing that right, Yvonne.
You are.
And I want to give you your correct job description, which is outreach representative at Verilife in Albany. And so we're going to be talking about how it all works. I mean, I know a lot of us, I always have to say this, a lot of us grew up in the 60s.
Yeah.
So we have some different kinds of ideas about the use of marijuana in general.
Yep.
We're going to focus on the medical uses, which are many and varied. So I'm going to silence myself. And I would ask that everybody please mute themselves, because background noises like my dog's barking interfere with the recording and the audibility of the rest of the program. And we'll pause at various times to have questions. Also, for most of you, if you go down to the bottom and hover over the bottom of your screen, there's the option to send a chat. So if you'd like to pose a question during the time when you're silenced on your microphone, you can do it through the chat, and I'll make sure that Yvonne gets the question. So there we go. So I'm going to say
everybody can hear everything, but just
yes,
some people aren't showing. Is that it?
That's correct. That's correct. So I'm going to turn it over to Yvonne. I'm going to spotlight her and say, take it away, Yvonne. Thank you for being here.
Absolutely. Well, first of all, good morning to everybody, and thank you very, very much for having me here today. I'm very excited. We can definitely do some questions, so please, as we're going along, if there's something that I'm not touching on, I'll probably touch on multiple topics today just to kind of get us started, get a little education, but please, I love questions, so ask away. Just to give you a little background on myself, I do work for Verilife. It is a medical cannabis dispensary here in Albany, New York. We have multiple locations across New York State, 4 dispensaries in New York, and we are spread out through multiple states. So a little bit of my background, so you're familiar with where I'm coming from. I worked in oncology before I came over to work for Verilife. I worked for oncology for over a decade. And prior to that, worked in multiple physicians' offices, hospitals. It's something that's always been personally very important to me, advocating for patients. So here in Albany, I worked at on the oncology floor at Albany Med. And before I came over to Verilife, I worked for New York Oncology Hematology. And I think working so closely with cancer patients for so long and dealing with trying to meet their needs as far as starting from diagnosis, going through the process maybe of treatment, whatever they needed to deal with as a whole person. When I started to think about cannabis more and how that could be so beneficial to those patients, I made a leap. I loved where I was, I loved what I did, but I knew that I wanted to be with patients in a different way. So for me, it was a personal motivator to move over into working in the medical cannabis field. So we can start off today talking about a couple different things. I mean, there's a lot to cover. So I think one thing when we start thinking about cannabis in general, often we think about the stigma that's still attached. And of course, I think that's something that's been changing over the years. I think as people are becoming more educated, as providers are becoming more educated, as we're having those conversations, it's been very helpful. I think that as patients are going back to their physicians and talking about the success they're having, it really helps open those doors for other patients. So I do know, though, that it is still, for some folks are willing to jump into it and they're ready when they come to us. And for other people, it is much more of a private process. I would say the one thing to do, if it is something you would be considering, would just start to have that conversation with your practitioner or provider. I think it's really important for all everybody on your medical care team to be really involved in what you're doing, any medication change you're taking, but it's always a good start to just have that conversation, see if it's appropriate to meet your needs. Another way to help with breaking that stigma is sometimes bringing somebody to an appointment with you, going to that provider's office, having somebody along with you so they're hearing those other things and you're starting to open those doors for people that are around you too. I think in any situation, it's very important for patients to feel supported, for people to feel supported in the decisions they're making medically, whether it's medical cannabis or they're considering another option for treatment. The more people you have involved, the more knowledge and the more support, I think you're just going to have so much better success. And educate and advocate, I always say, is so being very educated in those decisions in general, again, in any medical decision that you're making. And if you're comfortable enough to share some of that success with people around you, whether that's family members or friends, it may open the door for somebody else. I often have patients, maybe they'll come, and when they first come to the dispensary, they've chosen to maybe do it on their own and be quiet with it and kind of keep it to themselves. And they start having success. It's usually those family members and those people around them that start noticing those differences and will say, you know, what's going on, what's different for you now. And that's a great time to sort of open up those channels of communication. So,
Yvonne, I just want to pause here very briefly and let you know that it appears that Renee is on board. Renee, good morning.
Good morning. I'm so sorry. We had some technical difficulties.
That's quite all right.
And I do share an office, so I'm wearing a mask. I'll just remove it and say hi, everybody. For
morning.
Let me see where you are so I can spotlight you just for a moment. Where are you?
I think it's registering. It may just
there you are.
Stram Center with
there you go. I'm going to spotlight you just for a moment.
Thank
you.
Good
morning,
morning,
Renee.
Everybody. Good morning.
Nice
to see you.
You as well. And again, my apologies. So not only did I have a few moments of technical difficulties, but you know, the moment you step outside of your office, invariably you have people seeking you answers when you're like, I have to go right now. I need to be somewhere. So I do apologize. I tend to, you know, engage someone when they feel like they have a question.
So would you just introduce yourself briefly to the group? So
happy to. My name is Rene Scavio. I'm the practice manager here at the Stram Center for Integrative Medicine in Delmar, New York. I've been working with the Stram family for about 6 years now. And if you're not familiar with who we are, what we do, we are an integrative medical practice, which essentially means we treat the entire body. When you present to us with symptoms that are often uncertain or unclear, or patients who have typically been to many traditional types of specialists that haven't quite been able to pinpoint their diagnosis, we see patients come to us to help figure out what's happening. And integrative and functional essentially means we treat the body as a whole. So we get to the root cause of what your ailments are. So we won't just say, oh, you have high blood pressure, we'll write you a prescription for that. Or, oh, you've got some indigestion or reflux, we have a prescription for that. In fact, that's a last resort for us. Typically, if you're presenting with these symptoms, your body is unbalanced, we've got to figure out how to get you back in balance. And it usually is through multiple approaches. So it's about mind, body, and spirit. So we always discuss food, we discuss stress levels, we discuss the gut. And then we kind of do our investigative work and figure out why the body is inflamed or in pain or presenting with these symptoms. So we've been, using medical marijuana for several years now, and we have really provided some great relief for our patients, everywhere from, pre and post cancer treatments to, just severe chronic pain that's associated with various chronic illnesses. And, obviously the whole host of New York State approved reasons for medical marijuana.
Mm-hmm.
And you're going to cover those various reasons why somebody would be able to seek a prescription and receive a prescription for these cannabis products, correct?
Yes.
Oh, sure. Yes.
Yeah,
I mean, there's a
touch
list
on that.
of them. Yeah, either Yvonne or I can certainly go over them. All cancers are, covered. HIV, PTSD, if I'm off the top of my head. Actually, I do have my list handy.
ALS.
ALS, epilepsy, Huntington's, seizures. Well, those are conditions. That's a condition associated with Parkinson's, multiple sclerosis, any spinal cord injury. Can you think of any others, Yvonne? I'm sure.
I think you've covered most of them. I mean, definitely there's a little bit of a broader spectrum with those qualifiers. So something like chronic pain could be a qualifier, and other things could fall under that category. So, arthritis, inflammatory issues, they may fall under that broader range. And it's similar with PTSD as well. So PTSD you'll see as a qualifier, but under that umbrella of PTSD, we see multiple issues that patients are coming to us for. So if it's anxiety or depression. So there's definitely some very specific illnesses, chronic illness that we use as that qualifier. And then there's some broader terms that we can use to make sure that we're covering. Someone may have chronic pain. They may not necessarily have a chronic illness. So we want to make sure that we're covering all those different bases. So.
And I had a question here on the chat box, which is open to all. Should you care to put a question to our presenters? Are you covered by insurance?
So that is an excellent question, and we are not. So this particular practice is a non-insurance-based practice, and the reason for that is because we do not follow the business model of what insurance dictates an insurance-based appointment should look like. So all of our appointments here at the Stram Center are 60 minutes or longer. And as most of you know, if you've recently especially been to any type of traditional doctor's appointment, I think now we're down to about 7 minutes to say hi, diagnose, to listen to your symptoms, ailments, diagnose, prescribe, and get you out. So, Dr. Stram always felt that that's just no way to appropriately and properly treat a patient for whatever reason you're seeking medical assistance with. So for that reason, we are not an insurance-based practice. To establish as a patient with us specifically and only for a medical marijuana prescription, we do require that you provide us with the reason for the visit. So either a recent doctor's note describing your qualified condition. My patient's been treated for, is being treated for cancer or for multiple sclerosis. And if that's the case, then you come to us just specifically for that reason. We have our doctor review the note. Once it's approved, we schedule you an appointment, which lasts anywhere between 45 minutes and an hour. And it's $195. And then we would be able to write the prescription, register you with New York State, and then you're able to utilize, once you receive your card from New York State, to then go to the dispensary and purchase your product and work with the pharmacist in what is really appropriate for you on how you would like to use the product. If you're not sure if you're coming to us because you're fed up with the traditional treatment you've experienced, you do have a chronic condition, you want to fully acclimate yourself here with the practice as a medical patient, then part of the dialogue could be, as part of your treatment, we could prescribe medical marijuana. And that would be an extended appointment. That appointment would be anywhere from 90 minutes to almost 2 hours, working one-on-one with your medical provider. And we then kind of take over your healthcare or work with a specialist that perhaps you're currently working with. But that's where we do that investigative work. You know, what we could order labs for you, you have a physical examination, we review your health history, and, you know, part of the dialogue could then be using medical marijuana. And that appointment is $950, working with one of Dr. Stram's associates. And if you're working one-on-one with Dr. Stram, it's $1,100. So that's when you're fully acclimating as a patient. But again, if you come to us with just your medical history from a doctor's note, supporting use of medical marijuana, then it's a $195 appointment.
And also
for 1 year.
Yeah, to clarify, yes, you have to renew every year. The educational, and I was talking with Yvonne about this before we got rolling with the program. The educational component of what the patient receives, both on the end of the Stram Center and the end of the dispensary, is really quite interesting, because it's just, they assume that they explain everything to you about how these substances work in the body, what the ecocannabinoid system is. You might want to talk a little bit about that, because I find science interesting, and I'm sure a lot of the people who are watching now, information is power, and it's the power to make good choices. And that's what we're here to talk about this morning, to empower people to know what their options are.
Yeah.
So I just wanted to say a word about how thorough. It's not an in-out process.
Not at all.
It's very, very thorough on both ends, and very
and we have
supportive.
such a great relationship, you know, with the pharmacist, that we are very general in recommending what would be appropriate for the patients on how to take the product, and then we really let them connect with the pharmacist and finalize the decision that's really best and appropriate. So it truly is a partnership between the Stram Center as well. And we've had such great feedback from our patients, even from the pharmacist, and, you know, Yvonne as well. I've, you know, called and emailed several times, any questions, happy to even provide her personal number to potential patients with questions. And that really is a service that I'm sure you all have seen is dying. And we really value that we can offer that. So again, it's all sort of connected to the ability to offer insurance or not. But we cannot, you know, in lieu of being able to accept insurance, provide outstanding customer service to our patients.
Yeah.
This might be a good time, if just to pause briefly. We're about 24 minutes into the hour, and you've been providing some good information. So I'm thinking that people might have the need to ask some questions. So if you do have a question, please feel free to unmute yourself. We'll just wait a bit and go for it. I see Sue unmuted herself, so she must be smiling and ready to ask a question. And this can go to either Yvonne from the dispensary end or to Renee from the Stram Center, either one.
I was just curious for Yvonne, because you said you worked in hospitals and like at MYOH. Are you a nurse, or were you a nurse there?
Yep. No, I am not a nurse. I've always, I feel like, positioned myself in a way where I could advocate for patients. So I have had many, many roles over the years, working with patients, working with family members, being that support system. I did apply to nursing school and got into nursing school at one point, and I just decided, for me personally, I knew there were other ways that I could help support families, support patients. And so I've always found a way to do that, but I am not a nurse.
I was just curious because I am a patient at NYOH.
Yes.
And what was your role there?
I was the lead scheduler.
Oh, okay.
When I left. And towards the end, I was doing a little bit with the insurances, which probably not enough patient contact for me. So, but yeah. I worked at both the Albany Med site and the Patroon Creek site. So. Oh, did we lose?
Like we lost.
I'm back. Sorry, somebody was trying to call me.
May I ask a question? Oh.
To go back, oh, sure. Yeah.
I just started using CBD oil, and I'm new to the doctor, I'm new to everything, but I have questions which I haven't asked my own doctor yet. I take now 7 or 8 drops morning and night. How high, do you know how many drops people you can reach? And the next question is, will there be, does this really help pain? I have osteoarthritis and rheumatoid arthritis. Does this really help the pain? It hasn't really helped yet.
Well, I would say, where are you getting your CBD from?
From a pharmacy from which the doctor told me to get it from.
Okay. Are you local to Albany or?
No, she's
I was
in Greece.
born in Albany, but I live in the UK permanently, and I'm in Greece for the summer.
So unfortunately, not being familiar with the product you're taking, what the levels
just says 1,000 milligrams, 10 mils are in this bottle, 1,000 milligrams it says.
Yeah, I just, without knowing,
extra.
I mean, we could certainly sideline and have a separate conversation if you wanted to. I would not mind doing that at all. I would have to get a little more information. It is not so generalized. This is one thing I say about medical cannabis, and one reason I find such value in it, one of the reasons I find such value in it, is that it is a very patient-centered process. It is not a one-size-fits-all. There's many factors we have to take in when we first are bringing a patient in and we're talking about the regimens and trying to figure out what's going to fit and work for them. So I would be uncomfortable just making a broad generalization here, but we certainly could have a separate conversation if you were interested. Again, not being familiar with the product you're taking, but I could certainly work you through some of that. One thing I do want to say, and this brings up this point of, we hear a lot about CBD today, and THC. We're hearing a lot of news and a lot of different information. But there is one thing about CBD that I think is important to know, and that is there is an entourage effect that happens. So when you are taking a CBD product, and a CBD dominant product, which is amazing for a plethora of issues, and for any inflammatory issue, CBD is beautiful. We have just such amazing success with our patients. But you need to have that CBD and that THC in presence of each other to get that entourage effect. So that THC in a very, very low dose helps to be the catalyst almost for the CBD. So that
your oil is with THP, is that it? Or THC, whatever it is.
THC?
THC, because these are without THC and they're doing nothing so far.
And that could be part of why you maybe aren't getting the full benefit of the CBD product. That does work for some patients. But for other patients, I do find you really need to have both of those things together to get the full benefit. CBD also needs to be taken regularly so that it can build up in your system. And again, you really are getting that beautiful, consistent relief that you're looking for. But we certainly, again, I don't mind having a separate conversation. I can make sure that my contact info.
Do they all taste bad?
I have a question for you. would you go back to the basics? I've seen CBD cream. I've seen it for sleep on the bottom of your feet. I've seen it for pain. Recently in the Reader's Digest, the last issue, there was an article on CBD, and some people have taken it for insomnia and gotten great results, or for pain. But there's so many different types. Like, I just need to learn the basics too of what's what.
So CBD, one of the things we do when you come into the dispensary is what I like to call Cannabis 101. And I think it's really important to have that you are fully educated on the CBD component, on the THC component, on the ratios that are happening, because the ratios are also very important too, in learning what's going to balance out for you as a patient. When medical cannabis was first becoming legalized, one thing that they had to decipher or work on was, what are the broad range things that we can utilize that will help multiple patients? Because the plant itself, the marijuana plant itself, has many components to it. So THC and the CBD portions were something that we found could really help, would be the most broad and can help the most patients. It can be used in so many ways. And again, this is a very patient-centered process. So if you're talking about sleep, if you're talking about chronic pain, if you're talking about anxiety, if you're dealing with a chronic illness, if you're dealing with cancer, if you're dealing with cancer treatments, this one product can be used to help in a multiple of ways. So you will see it sometimes for an inflammatory issue, for a pain issue, for an anxiety issue.
Is oral drops?
So medical cannabis comes in many formulations. So there's an oral solution or a tincture that is a sublingual product, which means it's dosed out under your tongue. You hold under your tongue, most of the absorption is taking place there, and then you swallow it. So an oral solution, I find, for a lot of patients, is a really beautiful starting place too, because you also have control over that dosing. There are capsules, there are chewable tablets. There is inhalation methods, which we would utilize under certain circumstances depending on the needs. So let's say a patient with Parkinson's who has a lot of spasticity, a vape for them may be something they use because it is quicker, instantaneous relief. Quick relief, shorter term relief. When we're talking about longevity to relief, we like something that you do metabolize. So it'd be an oral solution, something that has a slow onset and stays in your system for a longer period of time at a nice even level. And that's why we like the consistent dosing as well. So,
how about the creams? Like, I know my mother's 89. She just went to a CBD store and she bought like a little thing of cream for like $100. But she uses it on her knee for pain, and it's given her some relief. So how do you know what type to buy or what the concentration should be?
Well, again, I just think that the benefit of going to a dispensary, sitting down with somebody who is going to walk you through that process, who is going to teach you, who is going to teach you about cannabis in general and how it can be utilized. That's the difference between going and getting, one of the differences between just going and getting it off a shelf somewhere and not being educated or know how to use it. What do these milligrams mean? How often do I take it? Do I take it with my other medications? There's so many things that need to be covered when you come to see us, and we are sitting down with you to try to fit that regimen to you. Have our pharmacist there to answer the questions, to talk about interactions with other medications, to talk about illnesses you may be dealing with. So unfortunately, getting something off the shelf, it can be done, absolutely, but I think going someplace where you can be more educated and it can be tailored to fit your needs more, and you can follow up. You leave, if you go to the dispensary, let's say as a new patient today, and you went home and you're like, okay, I have the 10 questions now I forgot to answer. Or
Okay.
I took it for the first time and I'm not really sure. And you need to call me. You need to reach the pharmacist. You need to reach the patient care rep that helped you. You need to talk to someone at the Stram Center. Whatever that is, it's that accessibility as part of your care team. I think that really makes a difference. So,
2 questions. Do you need a prescription for the creams?
are you in New York State?
Yes.
Okay, so in New York State, if you are going to, that is a great question actually, if you are going to go into a dispensary to purchase, you do need a medical marijuana card. If you are purchasing, someplace else at a pharmacy, you do not.
And where is your dispensary located?
So we are located, are you familiar with Stuyvesant Plaza?
Yes.
Okay, so 10 Executive Park Drive, right behind Stuyvesant Plaza. We're located we're actually all the way down at the end. We're our own entity. There's many doctors' offices back there, so you just go right down to the end back there.
Thank you.
Yeah.
And I did have something to add, if I may. There's lots of accessibility to non-prescription products. So what you were describing, you can go into a retail store and have your choice of many different products that are not regulated in any way. So oftentimes you don't know where they're sourced. You don't know all of the ingredients. You don't have to have any type of evaluation or conversation with a medically trained provider or a pharmacist that has really made it their goal to educate their patients. So you can go into a store walking along Broadway in Saratoga and probably have about half a dozen stores where you can purchase a tincture or a topical cream.
Yes.
And it's almost like going into purchasing vitamins. There's not a regulatory embodiment guiding us to say, this is a safe ingredient to have as an ingredient per se. So if you think of it, sort of in those terms, that you need a prescription to get a prescription strength product, you would need to see someone who can prescribe you with a license and follow up with a pharmacist. Just like you can walk into GNC and purchase a supplement that may have, some effect, of course, not knowing fully what you can do. So I think that's where there's a little confusion with products that are containing THC and require a prescription versus a product that you can purchase off the shelf at a retail store.
Thank you for clarifying that, because it does make you wonder, because you're seeing it everywhere now.
Right, right.
Yeah.
Even for your dog, right, Sue?
Yes.
Mm-hmm. And you would want to be guided with the appropriate, amount of how to dispense for obviously yourself as well as a pet, because it is effective and it can certainly provide such incredible relief. But, we are supportive of being guided appropriately by both a pharmacist and a medical doctor.
Thank you. I like that approach.
I don't know whether this is appropriate or not, but heck, I'm going to take a chance and I'm going to out myself here. For the last year and a half, I've been a medical cannabis patient through the services of the Stram Center and Verilife. And I have pretty widespread arthritis, also fibromyalgia that I've had since I've been in my 30s. And although people wouldn't know it because I teach yoga, which is, nothing is a placebo. You still have to do the work to keep yourself healthy and otherwise. I just want to add that in. There's no magic bullet.
Point.
But I was not happy with the prescription arthritis medication I was taking with the side effects. Mm-hmm. So I take a tincture at night, which is rather high in THC, low in CBD, because I'm going to take it and I'm going to go to bed. So there's no worries about being compromised. During the day, I have a vape, which I can use as needed. But because I sleep so well at night, my pain level during the day is much, much lower.
That's
So much lower that I've cut my arthritis prescription medication down by 75%. Now,
wow.
what I want to say,
It's so amazing.
please do not feel that my story is everybody's story. And I think the important takeaway from all of this conversation is to have the conversations, to talk with your doctor, your primary care doctor, to talk with the people who are going to be doing the prescribing, to talk with the people at Verilife. They will take every minute. I grew up in the 60s, but I was not a recreational user, so I was a little frightened.
Yes.
I was hesitant. Now I'm a believer. And I find it has enhanced my quality of life tremendously. So I think you're going to find that there are more and more seniors out there who are using the product successfully. But the main component to successful use is knowing yourself, number one, being able to judge your reactions. Number two, being able to trust the source for the product. I can't stress this enough because you don't know what's in those bottles at the co-op or the New Age store or whatever. You just don't know. So it's treated like any other medication in terms of quality control. And I've taken much too much of your time talking, but I figured,
No, it was important.
speaking from a user,
Thank you for sharing that. And I think we are slowly breaking down, you know, various stigmatisms that are still attached to using. And I will say most of our medical marijuana patients that are coming to us specifically for prescription are 55 and older. Yeah.
Yeah.
So you're amongst the company, and thank you for sharing your experience. And again, the true value is the customer-based support that is provided from both Verilife and the Stram Center. You can call, you can email, you can have question after question after question, you know, surrounding any of the products that are offered to you. Whereas, like I said, you can, you know, it's sort of, it's a little wild, wild west out there right now with some of the products that are available for retail sale. And, you know, just to be aware of that, you know, especially if you're already taking other prescription medications, you don't know what the ingredients are, they're not, you know, where they're sourced and what the interaction can be. And then oftentimes you may have a question that you don't know where else you can go, and you call your primary care, and that's not a supported circumstance. So, you know, you never want to feel unsupported in your journey.
I had a question from one of the participants, and this is for both Yvonne and for Renee. And it says, could you share some of your favorite articles so we can excel and pass Marijuana 101? Now, I do have I do have one article that Yvonne was good enough to send me about the pros and cons of cannabis use in seniors that I'll be sending out after the program. But also, if either of you have a source that you'd like to refer our participants to, that would be great, and I can include it in the follow-up email.
Okay, absolutely. Yeah, I can definitely send over some more literature afterwards. I know we've spoken about Dr. Mary Clifton, who is a physician in the city, and I don't know, Renee, if you're familiar with Dr. Clifton at all, but she's been a huge pioneer on the medical cannabis front. She is, I've had the privilege of listening to her speak. She's amazing, but she also offers a lot of online resources that are free to the public, a vast library of videos and information. You know, she is really just trying to get the knowledge out there and make it accessible to everybody. So she may be a good resource. I'll put that in there too when I send that over to you, Judy. Just she's just, it's easy. You can go in there, everything is organized, and really look at what you might want to look at that fits your needs. So she's a nice online resource.
And from the Stram Center, we really rely on Verilife for most of our information. And of course, when you have your one-on-one evaluation with one of our doctors here, they of course provide, you know, additional support and information. But it's just a small portion of information that I provide to educate our patients with. So really, if anyone would ask me, I go to Yvonne for all resources.
Here's an interesting question. Have you ever used medical marijuana to treat hiccups that won't stop?
I don't know if I've seen it specifically treated for hiccups. And I definitely could defer to the pharmacist a little bit more on that. But I would say what it could do, something with a higher THC product may relax enough to actually help with it. Although I've never had that as a specific, it is a good question, but I could see, again, the higher THC product maybe would help benefit with that. Yeah. Muscular, if we can get that to relax, it may help.
Interesting question.
Yeah. Did somebody ask that question? Because I'm going to find out a little bit more about that.
Because that can be pretty serious. I mean, we're joking about it, but I mean, it's one of those things that can be very serious.
I have personally, when I get the hiccups, it's pretty severe. It's pretty severe. It's never that long lasting, but it actually can be very painful. So I do understand. Yeah, I totally do understand. But it is an interesting thing. I haven't seen treated specifically, but it doesn't mean that it hasn't been. So I'll find out. I'll do a little follow-up on that.
Thank you. Anybody else getting some questions? Yes, spasm of the diaphragm. That's what a hiccup is.
Yes,
absolutely.
Yes. And it can be very painful.
Yes, very. So if there's no other questions, ladies, any additional thoughts maybe about just kind of reviewing the logistics of the process, explaining how once you get the prescription, how you can go online and get your temporary card, that kind of thing, and how that all works?
And I'll just, from the dispensary perspective, just in general, so you have, again, yes, so you have that general base. If you are interested in getting a medical marijuana card, the first thing to do, of course, is to reach out to your provider, to your practitioner. There are a lot of local practitioners. The Stram Center, obviously, a great provider in the area that just has tremendous support for their patients. So having that conversation first and getting what is called a certification, which is basically your prescription for medical marijuana. Once you have that prescription for medical marijuana, you then go on the Department of Health website, you apply for your medical marijuana card. If you are a New York State resident and have a driver's license or a New York State ID, the Department of Health will generate a temporary card for you that you can use right away. You can go right into the dispensary with that card. You get your permanent card in the mail in about 7 to 10 days. So it's prescription, or the certification as we call it, for medical marijuana, getting your card from the Department of Health website. As we both probably know, not a difficult process, but not always the most user-friendly process. So certainly at a dispensary that they can always help walk you through getting that card.
And I would add that the nurses here at the Stram Center will do that for you as part of your appointment with us. they will log on to the site for you and apply for that
Yeah.
for you.
Because that can be tedious for some patients. They maybe leave a different provider's office without that support, and then they're stuck on getting the card portion when you're so close. So certification, medical marijuana card from New York State, typically that certification is going to last you a year. In some instances, it may be shorter, but that would be tailored again to your needs and medically how often you need to be seen depending on what your qualifying diagnosis is, but usually a year. And then you can go into the dispensary. Once you go into the dispensary, particularly as a first-time patient, there will be, depending on what your needs are, that Cannabis 101, learning about the product first, learning about medical marijuana, and then transferring over into starting to talk about ratios and regimens, having the pharmacist there, going over medication lists, everything we need to have in the whole picture, because we are, treating the whole patient. It is a very patient-centered process, and all that information is really important.
So I'm gonna put a question out there. Again, it's for either Yvonne or Renee. Are there any, and this is kind of a moot point. I'm phrasing this question because I think it's some that people might actually have. It's not a question I have, but I'm just putting it out there. Are there any specific contraindications for the use of cannabis products? And more specifically, when it comes to the senior population, because the participants in this program, I'm assuming are pretty much of an age, any specific concerns that need to be identified? And are those usually identified by the prescribing physician? Anything picked up in the dispensary, that kind of thing. So whoever wants to field that question.
So I can start, which is the reason why we require an evaluation, to sit down one-on-one with our patient and review your health history. In fact, we require a qualifying condition to be reviewed by a provider before we even schedule your appointment. So the process looks like this. If you're interested in a medical marijuana prescription, you call the office, speak with me for a few moments. I would create a very open-ended sort of chart for you as a patient, as a prospective patient, and we would wait to receive your office note or the qualifying reason for you to be to schedule a medical marijuana evaluation. Once we receive that, our doctor will review it and either give us the thumbs up saying you qualify, please go ahead and schedule that appointment, or they would request additional information. So then I would call you back and obviously either schedule that visit or request additional information. Then during that appointment, you would work one-on-one with your practitioner to review if there would be any reason why it wouldn't be appropriate for the patient to use medical marijuana. For us, most importantly, is understanding usage and dosing, just like any other prescribed medication. So we request that if someone may be cognitively impaired or may bring a partner, a parent, a friend, a significant other, that could perhaps sit in the appointment with them and take notes or ask any questions as well, even though you always have, the pharmacist and the practice available to answer questions. We also, as available, and I know Yvonne could probably speak in more detail, you can have someone pick up and purchase. You can get a license as well. If you are able or unable to get back and forth to the dispensary, you can have someone have a carrying license, or I don't know what the right word is for
caregiver card. Caregiver card.
To purchase product. So, we really are trying to make it accessible for all that we think could be, benefiting from using medical marijuana. I don't know if you had anything to add to that, more clinically or, medically derived, but for us, having that that time in the appointment to understand and know your health history is most valuable.
Yeah. There are not many things really that you can take your medical cannabis along with all your other medications. Obviously, at that first visit, it is very important to review that and go over everything with the pharmacist. But you are able to take it along with everything else. There are a couple things that we would watch out for. Typically, if a patient is on a blood thinner, for example, we want to make sure that they are getting their blood work done regularly to make sure that there's no changes. If they're on a blood thinner, typically if you're on a blood thinner, that's something that's happening anyway, but we just want to make sure that it would be kept up on. Just that you're having those regular checkups in between to make sure. But certainly it can be taken along with everything. I would say, though, there are a couple of things that are very specific to an aging population, and that could be fall risks and dehydration. So things that I try to focus on, depending on the need of the patient with me, is we never want a patient to feel woozy or unstable. We're here to help give relief and quality of life, and certainly we don't want to do anything that would interfere with that. We're here to help with those symptoms. So I think for patients, being careful to stay very hydrated, because THC is actually a very naturally dehydrating product. We have to make sure that we're hydrating maybe even a little bit more than normal, and that we are taking a very, again, low and slow approach with how a regimen works for a patient. I would much rather have a patient come back to me and say, Yvonne, that was great. I'm starting to feel a little bit better. Here's what's going on. Can we work on this? This is wonderful. And have a patient go home and taking something that they feel overwhelmed by. And not that that would happen, but anytime you're introducing a new medication, any prescription, there's always that adjustment period. There's always learning how it factors into how it affects you personally. And so all those things we take into account and we need to be aware of. But I would definitely say specifically for our patients that are a little bit older, that we want to be careful of the dehydration and the fall risk aspect of it. And that is something to really consider when we're talking about a regimen for a new patient.
You know, as a nurse, I'm always telling people that with any medication, and certainly we're talking about cannabis as a medication,
Yes.
You're always looking at benefits versus risk.
Mm-hmm.
Yes.
And you're also looking at the fact that no two of us are alike in the way our metabolisms work, in the way our brains work, in the way we utilize drugs. So any product that's strong enough to give you some help
Yes.
has the potential to cause some side effects, which are not desirable. And I think it's really, really, really important for people to remember that. The medication is medication, whether it's cannabis or an aspirin or, you know, a cancer drug. So again, forgive me for speaking out of turn. Yvonne, you're frozen again. She's frozen. She looks like she's very meditative. So I'm going to spotlight back on Renee again.
Thank you.
But I also wanted to mention that Verilife delivers to people's homes.
Right.
So if you don't have an alternative to pick up your medication and you're homebound, they will deliver to your home.
Yeah. Well, thank you for having and for hosting us, and for a captive audience with really, you know, engaging and thought-provoking questions. We're available to answer any questions about the scheduling process, of course, and how we can partner with Verilife in making it not so taboo to use medical marijuana as part of your everyday lives. You can reach us. We have our website at the Stram Center. Our phone number is listed there as well. You can always ask for me, I'll be happy to help and answer any questions. So.
Thank you very much.
And Yvonne is coming back on again. She was frozen in the fabric of time.
Yeah.
But we're just closing up, Yvonne, and Renee was saying how people can reach out to the Stram Center for more information. And I know Verilife also has a really good informational website.
Yes.
So
You can go on our website. I'll also make sure that you have my information to pass on, because certainly anybody can reach out to me directly.
I will do that. I'll make sure that everybody has your email contact information,
Thank you.
as well as any additional articles that you care to send me. So
Okay.
folks who are here in the room, it may be a couple of days before I get all that together and out to you, but know that it's coming. And I want to, again, very, very warmly thank Renee, thank Yvonne, and thank all of you for participating. I think this was very, very helpful. So
Happy to have. Thank you.
So I'll greet you
Thanks
in the
for
way we do our
having us.
yoga class. Namaste.
Namaste.
Stay
Be well,
healthy.
everyone. Stay healthy. Stay healthy. Be well. Thank you.
You're
Thank
welcome.
you.
Thank you.
Bye-bye.